Welcome back to the Humble Healer podcast, and thank you for tuning in. I hope that you're going to find this episode worthwhile. And today we'll be talking about the second part of alcohol use disorder and just a brief screening tips for alcohol use disorder to see whether you or your family members have this issue, and then also some information about treatment, including outpatient treatment and also medications that are used to reduce complication from withdrawal, which can be fatal, and also to help with cravings for alcohol on a daily basis. Just a brief rundown of that for you to know that there are several effective anti-cravings and anti-withdrawal medications that are used to help treat patients with alcohol use disorder. So in the previous episode, we discussed the scope of problem that alcohol use disorders or AUD has on our lives and of those affected, and also general awareness of when to recognize that we have this problem. In the healthcare setting, we have two easy screening that we can do to screen for patients with AUD, and you can easily Google these screening methods. The first one is called CAGE, C-A-G. The C stand for this question: have you ever felt you need to cut down on your drinking? And it scores as a 1 point for yes and 0 for no. A stand for have you been people annoyed you by criticizing you, yes or no. And G stand for guilty. Have you ever felt guilty about drinking? And E is have you ever felt you needed a drink first thing in the morning? It's called eye opener to steady your nerves or to get rid of the hangover. So CAGE. So each answer yes is 1 point, and a score of 2 or higher had a 93% sensitivity and 76% specificity for the identification of excessive drinking, and similar sensitivity and specificity for identification of alcoholism. So easy screening method here using the CAGE method. To make it easier and to get the score, you can just put in MD-CALC. Another screening method is called the Audit C, AUDIT-C, and can also find it on, you can Google Audit MD-CALC, it will pop right up. And the first question is, how often did you have a drink containing alcohol in the past year? Second one, and it gives you a scale score: 1 drink, no drink, to 4 or 5 drinks, 4 or 5 times drinking a day. And then how many drinks containing alcohol did you have on a typical day when you were drinking in the past year? So it goes from 0 to over 6. And then the last question is, how often did you have 6 or more drinks on one occasion in the past year? So it'll give you a score. And female scores of 3 or more are consistent with alcohol misuse. Male score of 4 or more are consistent with also alcohol misuse. So once you identify potential alcohol problem, user dependence, here's some treatment and perhaps discuss with the family about how to start out with the treatment. The key is that the patient has to be agreeable to this plan and agree to get treatment. If they do not, then no treatment will be helpful. So this is a collaboration management involving both the patients, the clinicians, and the patient's family. The first most popular step is the 12-step programs. In general, these are for those with more severe alcohol use disorder and dependence. And in these patients, abstinence is the probably most successful treatment, not moderate drinking. In these patients, if they even have one small alcohol, then they will spiral that right down and turn into excessive alcohol use and intoxication and so on. The 12-step program will be the most appropriate treatment for these patients. And there are a lot of online programs that anyone can join with schedule throughout the day, 7 days a week. So it's very convenient. Just have a computer access and you log on and you can join a lot of different groups. Failures with the 12-step recovery programs are rare unless you're not compliant and you're not honest with your method, with your effort. So it's usually because patients don't fully commit to the program and not able to be honest with themselves. Some people think there's an easier way, but most cannot find one. So one has to be committed and acknowledge that they do have a problem and willing to open up and commit themselves fully to this program. In the 12-step program involve several steps where one need to find spiritual strength from God. If you are an atheist, and you can find spiritual support from the community, a therapist, your family, friends, your own subconscious mind, as I talked about extensively in previous episodes, then you can use that instead to provide that spiritual strength. The keys: be consistent and make sure you make that time to get online or go to an in-person meeting every day, since that is as important of a treatment as anything else for a severe alcohol use disorder. Daily communication with your subconscious is important about finding strength to allow you to abstain every day. Your subconscious mind will be your ally and be your supporter, and is your motivator. Something like, may I find the strength to keep away from alcohol today and still find contentment. Something like that, to say that every day. You can offer a unique help and support to fellow alcoholics. And one important therapy is to help others, and that will help you feel better. And that will be a good therapy also. And engaging newcomers, fostering connection within a fellowship, and a lot of time can provide that transformative power of watching people recover and witnessing the growth of the supportive community. For spouses and family, the consequences of alcoholism don't stop with the alcoholic, but affect those around them, like spouses, mothers, fathers, children, and friends. Spouses in particular are encouraged to meet with other spouses to share experience and advise it with others whose loved ones are alcoholics. Spouses face many struggles, including fear, resentment, and self-pity. They may also question their own judgment in choosing such a partner and wonder why their partner can't see the consequences of their alcoholism. We may also try various strategies, from sympathy to anger to seeking help or running away. It's important to recognize that alcoholism is an illness, so don't condemn your partner. It's the alcoholism that is distorting their behavior and thinking. But in some cases, it may be necessary to protect yourself and children from your alcoholic partner. If your partner is a heavy drinker and denies being an alcoholic, encourage them to acknowledge their problem and seek professional help. If your partner has a lack of control, they promise to quit or cut back but fail to do so again, encourage them to seek professional help also. If your partner is a binge drinker who had periods of abstinence punctuated by episodes of excessive drinking, express your concern. Encourage them to acknowledge the impact on themselves and their family, and seek professional help to identify the underlying reason for the binge drinking. And also be sure to prioritize your own safety and that of others, including your children. Seek support from professionals for yourself, and attend groups such as AI-ANON, which provide support to families of alcoholics. Each situation is unique and no one solution is right for everyone. So seeking professional help will help you work through the complexity of alcoholism and help both you and your partner on the path to recovery. Here's some medication that we use for alcohol use disorders to help with both withdrawals and also with cravings after the threat of withdrawal complications have been minimized. So one serious complication from long-term heavy alcohol use with abrupt withdrawal is delirium tremens, which can be fatal if not properly treated. Examples include those with severe alcohol use disorder and hospitalized for medical or surgical reasons. So there will be no alcohol in their system. A few days later, they started developing complications. Sometimes the treating medical team is not aware of the alcohol use disorders, so they can be surprised by the patients developing delirium tremens symptoms. In the hospital, we use two major classes of medications. One is by benzodiazepine, things like diazepam, lorazepam, and so on. But recently, medical research has found that barbiturates actually have been found to be more effective in helping patients with preventing serious alcohol use disorder withdrawal complications. So they need to be observed. They need to make sure that they are safe. And then the dosing for the medications treating the withdrawal symptoms can be tapered down to the point where they can be transitioned to the outpatient medications. And after the managing of the physiologic consequences of withdrawal, one can begin to talk about addressing the root causes of addiction. One can use the harm reduction principles that are adapted from the treatment of patients with opioid use disorders. Example, including in the past, hospital medical team handing out beer for patients to consume during hospital stays to reduce risk of serious withdrawal. These days, we just use benzodiazepines or barbiturates. And one patient out of danger of delirium tremens, the next step is outpatient counseling and support combined with anti-cravings medications. The first step to make sure that patient do well with this medication, to make sure that they agree to try these medication before prescribing. Without their collaboration and willingness to cut down on their drinking or abstain, no treatment will be helpful. Ideal solution is abstinence, but even helping them cut down to become more functional should also be attempted. One medication we use is called naltrexone, and you can give the patient once a day, 50 milligram, and you can avoid the medication in patients with liver impairment and those with daily opioid use, because naltrexone has also been found to be helpful with opioid use disorder. And we can talk about that in a different episode. There's also a monthly injection option for stable patients that have done well on daily treatment. It's called withdrawal. And the second medication, gabapentin, we can combine with naltrexone and can be used in patients with liver impairment. So monitoring the reduced dose in those with renal dysfunction with gabapentin. The sulforam is popular brand name is Antabuse. Not popular because of lack of compliance from patients, because it makes patients sick if consuming alcohol. So there's a very low rate of compliance for patients with alcohol use disorders. And one of relatively newer medication called acamprosate, which is safe in severe liver disease and works well, but is expensive. Topiramate is another medication commonly used for migraine prevention, but and also less for seizure disorder, and has been found to be helpful in reduce alcohol consumption. Also help with weight loss. And then ketamine infusion is an interesting new treatment. It has not gone mainstream yet, but found to be effective in some preliminary study. And you give 0.5 milligram to 1 milligram per kilogram over 30 to 60 minutes. It's very safe and not only help with alcohol, but opioid use disorders and more variety of other psychiatric illnesses such as PTSD, depression, anxiety disorders, bipolar, and so on. And a lot of the alcohol use and opioid use disorder patients have the dual diagnosis with mental health disorders, so ketamine can help with both. Thank you so much for tuning in for this episode regarding alcohol use disorder, easy screening, and also treatment for this problem. So let me know if you have any question or feedback, and thank you for tuning in, and happy